backing up to dental implants again, I guess antibiotics, is that right? Oftentimes are used, and you don't like to use those.
I think that we need to keep everything in our arsenal. It would be a mistake to say that I will never use antibiotics. It's not my first choice, but it's a choice. I think that the benefit of using remedies is you don't have the side effects, you don't change the flora in your body. A concern with antibiotics, and I've seen this with the slides that I take, is that 90% of our cells in the body are non-human cells. When you take an antibiotic, it has the potential to wipe out some of the good bacteria with the bad bacteria. So what we're trying to do in the office now is minimize pharmaceuticals and maximize healing. So remedies is a beautiful answer. I just had a woman.
So you have a pre-care and post-care for dental implant patients?
Absolutely. I just had a woman a few weeks ago who came in and she broke her front tooth and needed to come out. And you know, she's an aesthetically driven woman. She wanted the same day to have a tooth put in. And we took the tooth out, put an implant in, and instead of using pain medication and antibiotics, I gave her a great homeopathic regimen. She was pain-free. I saw her 2 days later. I was able to take out the stitches. And traditionally, you usually wait around 7 days. Because she healed so quickly with the herbal rinses that we use and the homeopathic remedies that we use, she was fantastic. And it's such a great option to offer patients.
Now, in Canada, is this rare? I mean, do you know of other dental practices doing it like this?
I don't think so. I
mean, you don't know of any.
I think that there are some dentists that are recognizing the holistic approach, and they're recognizing that there is a need to integrate what's going on with the mouth with the rest of the body. But what I'm finding is that some dentists aren't taking it to the next step. So there are holistic dentists who practice with a similar philosophy, but then when they need implants done or they need wisdom teeth extracted, they refer it out. And in my head, I feel that I'd like to keep everything in-house so that patients can better take advantage of the services. I don't see much point in sending a patient out to have their wisdom teeth extracted if then they're going to need the pain medication and antibiotics.
Is this the future of dentistry, in your opinion?
I believe this is the future of medicine. I think that we're really starting to see a shift where people are becoming aware that eating plays a huge role in your health. And the amount of sun plays a huge role. You see all over the place, people are taking vitamin D supplements and concerned about how much sun they're getting. And
it's fascinating to hear this from a dentist, by the way.
Yeah.
You know, our show airs, all over the United States. We're in Canada now. And I always like to think that I've heard it all sometimes, but this is great. I hear this from some of the medical doctors, and so you're combining that.
Well, I think that what I'm able to see is a lot of the signs and symptoms that happen in the body, I can see them in the mouth. If you're deficient in sun, deficient in vitamin D, it's not only going to affect your bones, it's also going to affect your teeth. So I can potentially see that. If I see a patient and I see that there are things going on and it doesn't make sense, why is someone so early losing teeth? Why does someone have such puffy gums if they take care of their mouth?
You can stop that and turn it around. Oftentimes.
Absolutely.
Good.
That's my job. And it's about working with patients towards health.
Now, what about root canal? And we are out of time. I mean, what are your thoughts on that?
I think that root canal is a controversy. I always have to question, is it better to replace the tooth with something else or try to keep
what is a root canal, by the way? I should start there too.
Of course. A root canal is normally you hear of a filling. A filling is when we take bacteria or decay out of the top of the tooth and fill it with a material. Sometimes that decay or bacteria gets too deep into the tooth and it involves the nerve area, the roots of the teeth in the bone.
So it's a bacteria that's hitting the root?
Yeah.
Okay.
And so what we do is we go in, we shape those roots, we clean them and fill them. Traditionally in North America, we use a rubber-based material that has no antibacterial properties. So we just fill that one long root and we rely on the body to resolve the remaining infection. There's a different type of material that's been used in Europe for 30 years. It actually is very alkaline, it's very basic. It diffuses into the tooth and diffuses underneath the tooth into the bone. This is what you do? This is what I use.
Okay.
And it helps to neutralize that long-term, low-lying chronic infection that can persist. Now, as a practitioner, I offer both materials. I go through the educational process and allow you as the patient to make a decision. What are you comfortable with?
So your father, Dr. Ira, do his patients, are they resistant toward you?
No, I think actually it's the opposite.
You look so young, by the way.
Thank you. I think that patients are excited because it does a few things for them. Specifically with me and my dad, there's a lot of continuity there. But I also think they're very receptive because patients in general are becoming more educated and more motivated about their health. And it's not just good enough anymore to say, oh, we're just going to put this filling material in and you'll be fine. But they want to feel ownership for their health and feel responsibility for their health, and we're able to provide that. I think something just as simple as filling material. And I have this video here that...
What am I seeing there?
You're
seeing a vapor of some sort?
It's the mercury vapor that is consistently emitted off a tooth, and it comes off 365 days a year, 24 hours a day. The mercury just evaporates, and it gets integrated into the body. There's been a switch, and my dad actually was one of the initiators of this. He switched in 1986 to using a resin filling material that's different than...
That's the white filling?
Those are the white fillings. And they have been shown to last as long, be as effective as the older mercury fillings. So we use those in practice. And now,
tell me this, by the way. Somebody watching this, they have metal fillings in their mouth. I mean, do you say to those people, get them out, put...
I don't ever say to somebody,
everybody, but I mean,
I'll never say to somebody,
say
get them out. What I will say is these are the potential health risks. These are the potential...
If it was a friend of yours, what would you say? Would you say, get them out?
No, because I think that each individual person has to take a look and see what is going on in their body.
All right.
If somebody is not well overall, it may not make sense to take out those fillings right away. If somebody has a very, very deep filling, they have to weigh the risk of, if I remove this filling, am I going to need a root canal to replace the filling? So there's a lot of parameters that go in, but absolutely 100% I consider that material to be unhealthy and toxic. And we take a lot of precautions in the office to ensure that you're not exposed to the material while we're removing the filling.
And we are just about out of time, but how is homeopathy different than pharmaceuticals? I mean, as you see it.
Well, I think
the advantages, I should say.
I think the first thing is that homeopathic medicine focuses on lifestyle or hygiene just as much as therapy, and that's critical to understand. But even just in terms of the remedies themselves.
Yeah, what are those, by the way?
These are my little homeopathic remedies. So this is hypericum, which is St. John's wort. And what they've done, I can show you here, is they've taken the St. John's wort, which is a plant, and they have extracted the essence of the plant in oil. So these remedies here, these little pellets here.
So those little pellets.
These little pellets are diluted to the 1,000th potency. So what they've done is they've taken that St. John's wort.
You just swallow those?
You put them under the tongue.
Let them dissolve.
They dissolve. If it's not the right remedy, it does absolutely nothing to you. It's just an energetic potency on a sugar pellet. And it's really wonderful because it's a gentle medicine. There's no interactions. There's no side effects.
And you use that particular therapy for what problem?
It's individualized to the patient. We're trying to predict the patient's symptoms, but often hypericum and arnica are two really great remedies for trauma, pain, bruising, nerve issues. Oftentimes I have a patient where we do a deep filling, and it's borderline. Is this a root canal? Is this not a root canal? And in modern dentistry, there's nothing that we can do to help that patient heal, to try to take that situation and bring it towards health as opposed to root canal. Hypericum is an excellent, St. John's wort is an excellent remedy at helping that nerve tissue resolve so that it potentially doesn't have to go to root canal. I just did it on my brother 2 days ago.
So you're seeing a difference. I mean, you see, once you started combining these therapies, your father sees a difference.
Yeah.
That people are getting better faster?
Absolutely.
Or maybe avoiding...
And I think the whole idea is that I'm not trying to do something to be different. I'm trying to do something to improve people's health. And anytime you can...
So this is not gimmicky?
Absolutely not. Anytime you can trigger somebody to heal, you can heal faster and you can heal better, why not? And if there's a time when I need to use a pharmaceutical, I'm happy to. But I find that the body responds better, and the more often somebody uses homeopathy, the better they respond.
Are you ever surprised at the results?
Often.
With this stuff?
Often. I'm very conservative in my treatment, and I'm very cautious with how I go forward. And so I'm often surprised as to the speed and effectiveness of the treatment that I'm doing.
So your father, who's been in practice there since I guess the 80s, are his patients resistant to this kind of treatment?
I think as long as you present something to somebody in a logical format, they're receptive. You have to be willing to listen.
I mean, are they asking for it now?
Who doesn't these days say, I'd like to minimize antibiotics? it's becoming such a well-known idea that antibiotics can cause harm, not just to us as people, but also to the environment, to the world around us. We're trying to minimize these pharmaceuticals. And to use homeopathy where there's no side effects and no interactions is wonderful. Pregnant women that come in with an emergency, and previously I'd be very frightened to give them an antibiotic to control that infection. At the same time, you don't want to allow an infection to persist in a pregnant woman. I can give her remedies. I don't worry about it. It resolves. It's fantastic.
Is your father, has he changed protocols?
Absolutely. I think that we're all changing and evolving as science changes, as we learn more. And just as an example, what we're starting to do now is preloading patients with usually arnica before surgery. We do it for a week before, and it really helps to minimize post-surgery trauma and pain. People just heal faster and easier.
Very interesting. I want to thank you for coming on the show. We'll have to have you back. I mean, this is a very big topic. And so you say it's the future of dentistry. So what do? You ask your dentist, look for a biological dentist? Look for a holistic dentist?
I think that a lot of it comes from educating yourself. Look online, start reading, and then go and ask your dentist questions and find a dentist that matches with your philosophy.
Great. All right. I want to thank you for coming on the show. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez.